I'm going to go over implementation in the end-of-life patient. So thinking about what medications they'll be given, and generally we can get an idea of what type of medications the end-of-life patient will get. They're quite common symptoms for all patients in this palliative care stage of their condition. So we do know most people will suffer with pain, nausea, breathlessness, anxiety, insomnia, depression and constipation, a combination of them, and obviously varying in different levels to different people, and how their conditions progressed. We do administer strong medications, usually opioids, to patients with severe pain, but they do cause side effects, and the doctors also need to be aware that they need to minimise these side effects. So if something shows up during assessment as a possible side effect of medication, we would let the doctor know, and just that it's a balancing act for the doctor to maintain the patient's comfort on all levels. One of the main problems is constipation with opioids or morphine. So we probably need to look if the patient has already been prescribed some laxatives, which would be normal if they were, and if they're not, probably talk about speaking to the doctor and seeing if they need prescribing. Antiemetics on the chart you are likely to see. You may see more than one type. That's okay. There are patients who are given many types of antiemetics. So do ensure you check before you give that medication. Have they got the same medication written on the PRN side as required, or the stat once only doses, as well as the regular? Because if somebody has given it on either any part of the chart and you're looking at another part, you may give it too soon. So make sure you don't do that. That could be a fail. So do look on all parts of the chart when you're looking at painkillers and nausea medication, just antiemetics, just to make sure that they haven't been given somewhere else. So the typical meds for the end-of-life patient and the cardiac meds that they're already prescribed are fairly predictable. So we've made them on a chart. Obviously, they could be on different medications, but these are common medications we've included. There won't be any controlled drugs in the OSCE for you to give, although like morphine, although they will have already maybe been given that quite recently, and we should check when they were last given it, because it will peak, and they may also need painkillers for breakthrough pain, which is quite common. So we give them their strong painkillers, and then they have to take other painkillers in between. So ensure you do look at all parts of the chart for painkillers and antiemetics. PRN medication is basically prescribed so that the nurse can decide when to give it. So you need to decide, does the patient need it and is it due? So if the patient has mentioned to you that they've had pain, but they had their morphine over an hour ago, we could assume maybe that painkiller should have peaked by now. And if pain is not controlled, that we should offer them something else that's on the chart. If there was by any chance nothing available on the chart, we would just mention that we're going to ask the doctor to review the meds. They may need to look at the different type of medication they're on and how it's given. Haloperidol is a common drug you see in end-of-life care. It's used to control anxiety. It also helps with reducing nausea and secretions. So that's why you do see this drug often in end-of-life care. And many patients may be affected by anxiety. So this is a good thing to help relax them. Levothyroxine is actually an antipsychotic drug, but at certain levels it can be used to reduce pain, nausea and restlessness, and has a good effect on their mental agitation and distress, which can be a common symptom in palliative care. It can be assumed that the doctor has informed the patient of any changes on their chart. So you don't particularly need to go over drugs like this one was added in, levofloxacin, when he came in. So you don't particularly need to discuss the merits of this drug other than just give its effects and side effects. So other points to check on the patient's chart: ensure that you have written your name in the part that it said for administrators must sign before they gave it. Do check the allergies. Check it once, check it more than once, because I have witnessed people in training giving the patient a drug they're allergic to despite already identifying they're allergic to it. So think about what you're saying, go back, double check that allergy. It's really important. And also mention the reaction they had to it. We need to also mention on the page that shows the oxygen administration, is the patient a CO2 retainer? So this could happen to a patient in cardiac failure, that they could be in respiratory failure as well, but not necessarily. So if the patient is a CO2 retainer, you would need to mark that on that part of the chart, and it's just a tick. Or if they're not a retainer, you can indicate. The patient may even be prescribed antibiotics. Some forms of therapy will continue, and if antibiotics are to help a chest infection or something that's bothering the patient, an infection, they will be given, and they will aid comfort in that case, despite this patient's prognosis. And as far as medications, I feel like I've covered everything here, and just to maybe get used to some of the names of these medications and how they work, please do use the chart and do practice, and I hope it's helped.